Well, welcome everybody to MedPsych Health. I have Dr. Mark Sykes with me today, and Dr. Sykes is a colleague at MedPsych Associates, and he is a psychologist who works with a lot of patients we actually share. And I wanted to have Dr. Sykes on with us today because I think Dr. Sykes has special insight into working with people who struggle with anxiety and obsessive compulsive disorder. So I'm going to call him Mark from now on, since I know him as Mark. And so, Mark, thank you for joining me.
Oh, thanks, Mo.
So if you notice that he called me Mo, so we are quite familiar with each other, and we'll self-disclose that right off the bat. So, Mark, can you tell me a little bit what you've been seeing over the last few weeks in terms of specifically folks who struggle with germ phobia and OCD and obsessive compulsive disorder? It's kind of fascinating to me kind of how many people are responding to this, but I'm going to let you kind of share some of your observations and insights on this.
Well, specifically with people who have some kind of a germophobia, if there's someone that has struggled with concern about getting a communicable disease prior to now, the average person's anxiety has increased. Mm-hmm. And a lot of the behaviors that they engage in that are response to anxiety have also increased. For example, excessive hand washing, things like that. Avoidance of things that people don't need to avoid. And this is a really confusing time for someone with anxiety, because some of the things that as a clinician I might advise somebody to do who has OCD, like refrain from washing your hands except in very specific periods of the day, or maybe even expose yourself to something that would provoke some anxiety of contamination to learn to adapt to that fear. That's changed a lot. Yeah. Right? Because now we have this, we're being instructed to be much more careful with fears of contamination and to wash our hands a lot more. So part of the trick for someone who's struggling with OCD or germophobia is to be balanced about that and to really recognize, are they washing their hands or avoiding a contaminant because it's actually reducing their communicating of COVID or some other illness, or is this more just an anxiety reduction mechanism?
It requires insight, right, and self-awareness of is the urge I have right now legitimate, or is this irrational and excessive, right? And that's not easy. And I work with kids, and the younger the kids are in general with OCD, they don't have as much insight to begin with. So that's a very kind of helpful to hear that.
That kind of insight that you're talking about, that can be developed. And not everyone I'm seeing that has anxiety or OCD is struggling. People that are actively using their skills, actively recognizing their self-talk, recognizing their emotions, stopping before they act, those people are often coping just fine. In fact, I have some clients that are actually flourishing because they're kind of seeing the power of the skills that they've developed in treatment.
And that really kind of goes to the benefit of treatment, right? In terms of that, just because I struggle with OCD or have in the past, does not mean a situation like this automatically, I'm going to fall apart, right? Because if someone has done the work, right, and they've put in the time, it bears fruit, right? And then this situation, they realize, wow, I can get through this. And that kind of reinforces the idea that, in terms of the benefit of treatment.
Absolutely.
Well, thank you for that. I think that was helpful, and see you at the next video.
All right.